Why adjusting the pressure valve on the CSF shunt is such a challenge? First of all, every individual is different in terms of CSF production. So during the day, you will see ups and downs in terms of CSF production. And since a pressure valve has a constant opening pressure, it is difficult to find a sweet spot for this pressure to cut just the right amount of CSF that would be good for the patient. Because we may have overproduction of CSF, meaning that during certain times of the day, we will see too much CSF being produced and the ICP going up, and during some hours you will see lower production and the ICP will not go up. So to adjust the single opening pressure to this changing environment is difficult. The second issue is the activity of the patient. So some people tend to be mostly vertical, or they walk a lot. They have a different hydrostatic gradient, and some people will be mostly supine or sitting. Some people will flex their abdominal muscles a lot and increase abdominal pressure a lot, and this will influence the ICP level and push out portions of this CSF volume. So all those things introduce a lot of variables that are difficult to mitigate or optimize just with one parameter, namely the opening pressure of the valve. So sometimes it takes a lot of adjustments, and it may also change for the same patient as the physiological status changes, activity status, whether the patient grows, for example. So for pediatric patients, it will also change with age, body mass, and so on and so forth. So basically, this is why it's so difficult. Fortunately, these days we have valves that can be adjusted externally, so there's no need for a surgical procedure. And so we can just sit, take a gizmo, put it over the valve, adjust, change the pressure, and see how the patient reacts to this new setting. However, it does not change the fundamental problem that the CSF production, thus the ICP level, are highly variable, and they depend on multiple factors, not only one or two.